Hi class, my name is Maria Salazar, and for the Unit 7 discussion, I have picked as my population African American woman. So there is we have cultural issues, African American woman, why cultural issues are important in psychotherapy. Numerous cultural barriers have been seen affecting African American women access to involvement in and use of psychotherapy. One problem might be that they might believe treatment is inappropriate for them or not relevant to their culture. It is possible for African American women to believe that their therapist is indifferent to them or their culture. African American women may also think that their treatment is not private or that the others would judge them. For African American women, these problems may affect how well treatment works. It's important to recognize these problems and make effort to solve them. For African American women, these problems may affect how well the treatment works. It is important to recognize these problems and make effort to solve them. Numerous cultural barriers have been affecting African American women to access involvement, to access help, to access any type of psychotherapy. Sometimes even them seeking treatment could be an issue. One problem might be that they believe treatment is inappropriate for them or not relevant to their culture. It is possible for African American women to believe that their therapist is indifferent to them or their private or other would judge them. For African American women, these problems may affect how well treatment works. It's important to recognize and solve these problems, like I said before, making sure therapists are aware of these problems and making an effort to be culture competent as a method to solve them, making treatment accessible and inexpensive for African American women as an option to address this problem. Ultimately, it is critical to ensure that African American women in treatment have safety and comfort. Factors impacting access, engagement, and the use of psychotherapy. There are many things that can affect who can get psychotherapy, how much they use it, and how engaged they are in it. One thing is cost. Just because insurance is not always accepted when you try to get psychotherapy, people may not be able to get it to help. It's too expensive for them. One more thing is access. Maybe where they are, or like you live in a place where there's no so accessible. Most towns don't have access like cities, and clients might not be able to get the help they need if there are not enough therapists. Privacy is also a very important issue. If clients don't feel safe and private in therapy, they might not want to go through with it. Lastly, society can affect how easy it is to get psychotherapy, how engaged people are in it, and how often they use it. Folks may not want to go to therapy if they think their culture is not being shown or understood. All of these things can affect the way treatment works. One thing, now we have a lot of or we have access to the internet apps. There's a lot of psychotherapy involved in that. But if you're old school, you're not going to want to use a tablet or a computer or anything like that. You're going to want to actually see the person. So that might be a barrier too. Besides the things we have already talked about, the other things that can affect how well therapy works for African American women, one thing to consider is the therapist's race. If the therapy is in the same race as the client might not feel like they're seen or being heard. The therapist's gender is another thing to think about. If the therapist is not the same as the gender, the client might not feel safe talking about person, things. All of the things that can affect how well treatment works for African American women. You should be aware of these problems and do something about them as a psych MP. Sometimes we're not able to decide that because if the insurance is paying for it, it doesn't always pick an African American psych MP or therapist. So those are things that affect the culture. But if there's things that we can help as a psych MP and provider, those are things to keep in mind. And here are my references. Thank you so much, class, for paying attention to my post. Have a great day.